everybody. I'm Andy Bozarth, Director of Community Outreach and Advocacy here at AARP, Kansas. Welcome to the Coffee Chat. Today, I'm joined by April Holman, who is the Executive Director for Alliance for a Healthy Kansas. Hi, April.
Hi, how are you?
I'm doing well. How about you?
Fine, thank you. The sun is shining, so that's a good day.
Oh, it's definitely nice outside. I'm grateful for these warm temperatures after that cold spell we had.
Absolutely.
So we're here today to talk about KanCare Expansion. And I was wondering if you can give me just a little bit of an explanation about what is KanCare Expansion?
Sure. So KanCare is the name for the Medicaid program here in Kansas. And we've had the opportunity since the Affordable Care Act was passed about a decade ago to expand eligibility for our Medicaid program. And the federal government pays for 90% of that, and the state just has to pay 10%. So it's a much more beneficial rate than we pay for the other types of coverage through Medicaid. And it's something that really is an opportunity to get insurance to more Kansans, especially those in need.
And approximately how many Kansans are there that are in need of insurance?
Well, we've always talked about 150,000 people who would benefit from KanCare Expansion. But this year, the state increased their official number, I think, to reflect the economic fallout from the pandemic. So now we're talking about 165,000 people who would benefit from this policy change.
Wow. And I know of that 165,000, about 20,000 are between the age of 50 and 64. And about 7,400 of them are veterans and their families. And so besides the veterans and their families and the people between the age of 50 and 64, who benefits from expanding Medicaid in Kansas?
Sure. So we're really talking about adults. So people between the ages of 19 and 64. So like you said, a lot of those people are older and they are maybe at retirement or approaching retirement age, but they aren't at the age when they start to be able to receive Medicare. So when we look at the population overall, about 2/3 of the people who would qualify for KanCare Expansion would be working. Many of them are working multiple jobs, and they just either don't have coverage that's available through their employer, or the employee responsibility, the cost that they would have to bear is too much for them to be able to afford. So really, we're talking primarily about people who are working in lower wage jobs who are really just stuck without a lot of options for healthcare insurance.
Mm-hmm. Yeah, there are so many people in many different situations. I know of a person who is in his early 60s, and he had healthcare insurance because he was raising a daughter. But when she turned 18, he actually lost his healthcare insurance. And so is that a common scenario?
It is. So the way that the KanCare program works now is that if you have a child under the age of 18 in your home, then you can earn up to 38% of the federal poverty line and be able to get coverage as an adult through Medicaid. Now, if you are a childless adult, so that would be someone who either, maybe has adult children or they don't have a child at all, then they don't qualify no matter how low their income is. And just kind of going back to that 38% of the federal poverty line, we have a pretty stripped down program here in Kansas. That is not a lot of money. So just to give you a frame of reference, let's say we had a parent with 2 children under the age of 18 in their home. They wouldn't be able to make more than about $82,000 a year before they would already make too much to be able to qualify for KanCare. So
Wow.
it's pretty hard to it's pretty hard to survive on that level of income. We don't find as many people who fall into that category.
Yes, that's a very low number.
Yes. And then on the other side of that, the Affordable Care Act also provides subsidies for people to get private insurance through the private marketplace. But you have to earn at least 100% of the federal poverty line in order to qualify for those. So we have this very strange situation where people end up making too much money to qualify for Medicaid, but they don't make enough to qualify for those subsidies. And they're just stuck in this healthcare coverage gap, unfortunately. And there are, tens of thousands of Kansans who find themselves in that situation.
It's a very hard situation to be in because right now healthcare is a healthcare insurance is a necessity for any kind of financial well-being. Medications, medical care is all very, very expensive. And it is the number one cause, or medical bills are the number one cause of people going bankrupt in our country. Earlier, you said something about people between the age of 50 and 64, that's at age 65, people can go on Medicare. Mm-hmm. Can you explain a little bit what is the difference between Medicaid and Medicare?
Sure. So they're really totally different programs. They just start with a similar name. So Medicare is that healthcare coverage that we're familiar with for people who are age 65 and older. Medicaid is a program that was intended, it's a federal state partnership, and it's intended to help lower income people. So that's where we get, in Kansas, that very low threshold of 38% of poverty, but that really doesn't reflect the ability of people to pay for and afford health insurance when you look at very low incomes. And so I think that was one of the reasons that the Affordable Care Act was trying to provide a continuum of assistance that started all the way with that, traditional Medicaid program, and then goes all the way through 400% of poverty is the cutoff, the regular cutoff for those subsidies. And then Medicare is something that is really a fully federal program. So there doesn't need to be that partnership with the state, and there's never been a need for the states to opt in to Medicare in order for their residents to be able to take advantage of it. So two totally different programs that just sound the same.
Well, thank you for that explanation. I know that people get confused about that quite often. For those of you just joining us, welcome to the Coffee Chat. I'm Andy Bozarth, Director of Community Outreach and Advocacy, and I'm joined by April Holman from the Alliance for a Healthy Kansas today, and we're discussing Medicaid expansion in Kansas. As I said, we're discussing it in Kansas, but April, can you tell me how Kansas compares with our neighboring states?
Well, since this opportunity was first provided, so the first states could opt into Medicaid expansion in 2014, and Colorado, which is one of our neighbors, jumped on that opportunity right away. But we're now at a point where 38 states have already expanded eligibility for their Medicaid programs, and that includes all of our neighboring states now. So we think of ourselves as an island in a sea of expansion. And there are some real repercussions for that. So right now, Nebraska and Colorado already have their programs up and running, but Oklahoma and Missouri just passed their Medicaid expansion through a ballot initiative last summer. So they're in the process of doing all of the rules and regulations and getting everything set up so that they can go live July 1st of this year, of 2021. Once that happens, we are really going to find ourselves struggling to be able to keep our qualified medical medical personnel, especially in border communities, because they'll be able to pay more on the other side of every border of Kansas. Part of that is because, unfortunately, just because you don't have insurance doesn't mean you don't get sick. And so when people seek care in hospitals and with other medical providers and aren't able to pay those bills, the provider is left with a lot of uncompensated care that they need to write off. And when our neighboring states, the providers in those states don't have that uncompensated care, then they're able to pay higher salaries. They're able to make more investments in, healthcare equipment and other types of infrastructure. So first of all, there's going to be, that ability for them to lure away our qualified medical staff. But it's also going to put us at an economic development disadvantage because when companies are looking for new places to locate, or if they're looking, even our companies in Kansas that are looking to grow and expand, they really look for places where there's a full service hospital. And our hospitals are struggling, especially as we look out in the rural areas of Kansas because of that uncompensated care, because of other issues too. But Medicaid expansion is an important part of bringing more dollars in to help them be more self-sufficient for longer. So hopefully we will get on board here in Kansas before we start to really feel some of the consequences of that decision to stay an island.
Yeah, being an island does not sound like a really good position to be in at this point in time.
No, definitely not.
We talked earlier about the pandemic and the changes and that's increased the need for insurance, but how can the state actually afford expansion in the midst of the economic fallout from the pandemic?
We hear that question a lot. And so, as I said earlier, the federal government pays for 90% of the costs of the expanded population, and then the state's responsible for paying for 10% of that cost. So, first of all, there are a lot of savings that the state will see because they're not paying for, as much to cover the healthcare for prisoners, for example, or for, moms who would now qualify for help if they're pregnant, but the state would bear a higher cost. If they had been covered before they became pregnant, then they would, we would have only 10% of the cost of their care. A lot of different things like that where we'll see savings. And then the other part of that is when we bring in these hundreds of millions of dollars, it's anticipated that it would be somewhere north of $720 million a year that we would bring into the state of Kansas. And then that creates a lot of kind of a ripple effect and more economic activity. And all of that helps to bring in new tax revenues to the state. So when you have somebody who comes in to the community as a new medical provider and they shop at the grocery store and they, go to the restaurant downtown, that's all creating that economic activity. And it's anticipated that the state would bring in between, somewhere between $31 and $39 million a year in that first year that we had the expansion in new tax dollars. So when you put all of that together, it really all but pays for itself. It could be that the state would have, maybe $1 million or $2 million that they would need to come up with, but it's really a small amount compared to the enormous benefit that we'd be looking at.
Wow, those are big numbers of money coming in to the state.
It's huge.
And where does that money come from?
Well, it comes from the federal government. So it's part of that. That's part of this plan. So when the federal government pays for 90% of the cost, it's coming in those federal dollars, and it's going, to our providers to help, make them more financially stable. It's helping consumers to have the access to affordable care that they need. so many people, especially I think in Kansas, people are not, they know that there's going to be a bill that they can't pay. And so they just don't go to get the care that they need. And so, this would be an opportunity to help people really feel comfortable going and seeking the care that they need at a time when it's most beneficial, catching those illnesses early on when it's less expensive, but also it's, more likely that they'll be able to stop the progression of the illness or even reverse it.
Yes. And for those of you just joining us, I'm Andy Bozarth, Director of Community Outreach and Advocacy here at AARP Kansas. I'm joined by April Holman from Alliance for a Healthy Kansas, and we're discussing Medicaid expansion. And if you have a question, please put that into the chat box, and I'm sure April will be happy to answer it. And April, we do have a comment and questions. Somebody says, welcome. And the first question I want to ask you is, will Kansas be able to utilize the recovered funds from the addition of federal funding to expand KanCare staff to accommodate the increased workload?
I'm not sure. I thought I knew where that was going. And so can you say that last part about the staff and workload again?
I think it's to utilize recovered funds from the addition of federal funding to expand KanCare staff to accommodate the workload increase. I think maybe she's talking about increasing, if there's an increase in need for medical care, will we be able to use the KanCare funding to staff the hospitals and pay?
Absolutely. Right. So that's absolutely one of the things that providers say they would spend the increased dollars on. So if they were getting more of the care that they provide paid for, then they would be able to hire new staff potentially. They would be able to make investments in new equipment that they might not otherwise be able to afford. I think that there are any number of things, but staff is very important. And sometimes we hear questions about, well, if we have more people who are going to be able to access care, then will we need more providers? And I think the answer to that is that, one of the benefits of not being the first state to expand, one of the only benefits, is that we're able to see how this plays out in other states. So in the 38 other states that already have expanded, they have been able to, scramble and get up to the capacity that they need, which is not to say that there won't be a need for more people in the medical profession, but I think that that's already the case. And so states have been able to get up to speed, and things are going well. No state that has ever expanded has made a decision to turn that back and to go back to the way that it was before. And that's certainly allowed under the federal law.
Thank you for that explanation. And there is she also wrote, an increase in the numbers covered will result in an increase in interactions with clients. So you did answer exactly what she was asking. I kind of want to go back to what you were talking about the federal tax dollars being used to fund this program. And does that mean that the taxes that Kansans are paying in, those taxes are going to other states instead of Kansas to fund this?
Well, actually, that is, that's what's happening right now. So we're all paying taxes just like they are in Colorado, but our federal taxes are really kind of, being diverted to benefit people in other states. So it really is a little bit of, it seems like an unfair result that Kansans are paying into the system, but not getting everything that they can back out of the system. And it's something that we desperately need here in our state. So we're not just talking about, profiting from the federal government. We're talking about the opportunity to provide a vital service that both consumers and providers in Kansas need. And it helps our economy as well.
Thank you for that. Now, I've heard about new incentives from the federal government for the 12 states that are holding out on expansion. And is that true? And can you tell me more about it?
Sure. That's something that's happening right now. And it's actually very exciting for those of us who are advocating for expansion in the 12 holdout states. So in the next round of COVID relief, which we anticipate will be passed by mid-March, there is a proposal to provide this extra incentive for states to be able who are newly expanded. So for instance, it's been written so that Oklahoma and Missouri will be able to take advantage of these new dollars. But basically, by expanding Medicaid, a state, one of those 12 holdout states, is able to unlock an additional pot of relief, COVID relief. So in Kansas, that's expected to be about what I've heard initial estimates that were $330 million over 2 years. I've heard other estimates that are even higher than that, in the $400 million range. But it is only for 2 years. It's not meant to really pay for Medicaid expansion because, like I said, through savings and that those additional taxes that come in, it all but pays for itself. But this is really just a way to unlock new COVID relief for us. And for the federal government, it's a way to get more states on board with this.
Wow. That's a really good incentive.
It is. And, you probably know this, but our budgets are really tight because of the economic fallout from the pandemic. So we're looking at potential budget cuts going into next year and, the year after that. So this would be huge in bringing all of those new dollars in for relief to help, possibly eliminate the need for cuts, or at least be able to mitigate that considerably.
And for our listeners, if they want to have Medicaid expanded in Kansas, what should they do?
Well, I think the most important thing that you can do is let your elected officials know that this is something that's important to you and help them understand why. I think it's really interesting to me that we have a coalition of about 120 organizations. AARP is a big part of that. But there are so many perspectives that really, this policy change would make sense to. So anywhere from, providers to AARP to community action projects who help lower income people to foster care providers. There's just so many problems in Kansas that this would be part of the answer for. So it really is meaningful if you let your elected officials know that this is important to you and explain why it's important to you, and just really keep putting pressure on, because we don't want anyone to think that this is not something that people in Kansas want. We know that through polling, 62% of Kansans polled in the latest Kansas Speaks poll that was issued late last fall. They support Medicaid expansion, and we need all of those legislators who are holding out their support to know that this is important back home with their communities and their constituents.
And with that 62% who support it, why have we not gone forward with just taking it to a public vote?
Oh, that's a good question. So some of our neighboring states, actually 3 of our neighboring states, Nebraska, Oklahoma, and Missouri, have all passed Medicaid expansion through a ballot initiative, but we don't have that option in the Kansas Constitution. So there would actually need to be a constitutional change before we would be able to do that. And in order to change the Constitution, you need even more votes than you need for, expansion. So it just has not been, unfortunately, an avenue that we could use here in Kansas. We have to go directly through the legislative process. And there are a lot of legislators who support expansion. I should just say that this is not a partisan issue. Both Republicans and Democrats support Medicaid expansion. And that's actually the case. Obviously, if there are 38 states that support it, that some of those are red states and some of them are blue states. This is not that type of issue. This is something that's supported really by across the board through the political spectrum. But there are particularly some very conservative legislators who are in leadership positions in our legislature, and they've been able to block any meaningful progress on expansion for the last several years.
That's really sad. So it's real important that people contact their legislators and let your legislator know that it's important to you that Medicaid is expanded in Kansas. And April, we have a couple more questions for you. We have one question. It says, don't we almost have the votes in the legislature to pass this bill?
Yes. So by our count, we're just looking to flip about 3 votes in the House and about 3 in the Senate. And quite honestly, I think it might be fewer than that. So the Alliance and our partners have already been working on this, since we knew what the legislative composition would be last fall. So I think we're so very, very close.
That's great. Thank you. And then here's another question. Do you feel that the Medicaid expansion would help to have more vulnerable residents get vaccinated against COVID-19?
Absolutely. So I think, the vaccines are free. So I would just, encourage people, if they have the opportunity, don't fear the cost. I do think that there, in some instances, can be a cost associated for not the vaccine itself, but giving the vaccine. So make sure that you ask questions and don't have surprises for that. But I think overall, we get back to this idea that people who know that they're covered are more likely to engage with healthcare. They're more likely to be on top of things like vaccinations. And they're more likely to be really thinking, I have the opportunity to be healthy, because sometimes people just give up and check out of that if they know, well, even if I go to the doctor and even if I find out that I have COVID, for instance, what am I going to be able to do about it? So why would I go through and incur all of the cost for that? So I think that this would make a very big difference in the overall health of our neighbors and our communities.
Thank you. And we do have another comment. It says KanCare Expansion would help to retain valuable staff for providers by making wages more competitive. And is that true?
Absolutely. I think that we have already seen some examples in other programs, particularly in mental health programs, where our neighboring states went ahead and took advantage of new federal funding opportunities. Kansas didn't, and we have lost a lot of providers, particularly from border areas. So I think we would expect that same thing to happen, starting in July, particularly once Missouri and Oklahoma have their expansion up and running. We will just not be able to pay the same types of wages in Kansas that they are in those neighboring states.
That's very true. And April, I'm sorry, but we're at the end of our time. And I know we could go on and on with this. So if you'd like to make one recommendation to everybody, what would that be?
My one recommendation is please reach out to your elected official. If you have a chance, send a letter to the editor to your paper. Talk about this with your friends and neighbors, and let's make sure that this is something that people know about, and we build pressure so that we can make this happen as soon as possible.
Well, thank you very much, April. I really appreciate you taking time out of your schedule to join us today. And thank you to those of you who joined us on the chat. And we'll see you next week, same time, same place.
Thank you so much for having me.